This is a joint venture between psychology with quite a bit of help from alumni relations. So thank you to the alumni office too. Oh yeah, thanks so much. Also, you should know that our some of our initiatives this year that has to do with careers and career building is being sponsored by a grant from CEDL. CEDL stands for the Center for Excellence in Teaching and Learning. So we got a grant from them that's helping us support some of these things we're doing this year, including the alumni panel, but other things like building up our internship program that we'll talk about later. We have a few folks joining us online who are panelists, as well as some students, as well as the folks you see here who I'll introduce in a moment. But again, thanks for everybody who helped put this together. Thanks for coming today. Okay, I think I will just go ahead and introduce our panelists, and then we'll decide who's going to go first. And also, if you're in person, obviously here, then those little cards are for questions, especially if you don't want to ask them directly. If, this is like a more intimate group, so we can definitely ask them directly if you want to. For those of you online, if you don't want to talk to us online, then you can always use the chat, I'm almost sure. And if for some reason, if you're not getting the chat option, then just speak up. You can unmute yourself. Okay, so very good. So today we have online, we have Paige Rector. I don't know if you can hear us.
Yes. Hi. Yep, can you hear me?
Yes. And she works with community health, and I'm not going to do a whole lot of introducing because I want them to talk. And then we have Sarah Schatz. I hope I'm pronouncing that correctly.
Schatz, yeah.
Yes, okay. She is a BCBA, so a behavioral analysis, and again, she'll talk about what that involves. In person, we have Anthony Gonzalez, who is a lawyer, Jody Harwood, who is a therapist, and finally Chad Pocock, who is a MSW student, almost done, and also went through our internship program. Okay, so again, I want them to introduce themselves more. The format today will be to have them talk for 5 to 10 minutes about what they're doing and how they got there. We probably can pause for a few questions right after each speaker, and then we'll have more questions and answers at the end. Okay? It really doesn't matter who goes first, but in person, we see Anthony first. So can we start with you? Okay.
Did you want to put that light off so people can see this screen?
We can try.
It's this one. It's this one.
Oh, it's this one. Okay.
Yeah.
I got it. Don't worry about it.
I'm just going to stand because I tend to speak standing in my job. I'm a public defender for the Saginaw County Public Defender's Office. I'm a Saginaw native. I started at SASA, Saginaw Arts and Sciences Academy, came to Saginaw Valley. I was a criminal justice major with minors in psychology and political science. Took the LSAT, decided to go to law school at Michigan State. I graduated from Michigan State's law school in 2020, just as the pandemic was starting. Worked for Judge Beal in Midland County for about a year and a half or so. Came to the Saginaw Public Defender's Office while I was studying for the bar. Took the bar exam, and I've been licensed for almost a year now. I'm handling cases from anywhere from driving license suspendeds up to 10-year felonies, so the whole gamut of different things. My daily life, I guess, kind of looks client interviews, going to the jail, calling people in and out of court a lot, speaking with judges, speaking with prosecutors, focusing a lot on mental health treatment for those clients that need it, drug treatment for those that need it. It's not so much about incarceration, at least in the way that I practice. It tends to be a lot more about trying to get people help where they need it to stop them from coming back and having more issues. I'm not sure what else to really talk about. I don't know if anybody has any questions while we're here. I know that was kind of brief, but yeah, go ahead.
So, how do you think a degree, or I know you said you had a minor in psych.
Yes, sir.
How does psychology help you in your job? Because people don't naturally connect psychology and law.
Yeah. Studying psychology, I mean, in the criminal justice program here too, also talk a little bit about some of the specialty courts, but kind of understanding that some of the things that cause people to commit crimes can be a little more socioeconomic, or if they are having some mental health issues that they need to then get further assistance with. What's been a big benefit for our office too is that we actually have a social worker in our office Maria Romo, I don't know if anybody, that name's familiar at all. She works in our office and she does a lot of help with those things as well. But having a little bit of background in psychology just gives a little more insight into what can cause someone to commit a crime. And understanding that can be the first part to being an advocate for them, really. So.
I wonder if you could address like some understudies that might be from psych majors or people with criminal justice and psych major that you could maybe, is there a way that they could work with you or get an insight in what your work entails so they can be better prepared for their future career?
In the sense of like right now or just how
Just in general,
yeah,
that
so
we could set up things.
of course, we actually, so we're working on, our office is relatively new in 2019. There was a big push from the state of Michigan to get more funding for public defenders' offices, which is how our office was open. So we're working right now to try to get more interns in.
Okay.
I understand that we actually have an SBSU intern who's there right now. I don't interact with her much just because I'm so busy. But we're trying to get more interns to come in and kind of get to experience what that life looks like to figure out whether they want to go into the law or not. So that's kind of what we're pushing for right now, I guess. But yeah, good.
You talked about psychological disorders. About what % of your defendants maybe have psychological disorders, and what are the more common types?
I don't know percentages necessarily. Not a statistic that I really keep. I know I've had a lot of clients who require AFCs and things like that they need a little bit more help and guidance through because, and I guess there's a stigma too of if you're an AFC then you're a little more incompetent, but that's a completely different term for in the criminal justice world. Where I've referred some clients for to see whether they're competent to stand trial, and have had many come back as competent, only one come back incompetent. So there's, I would say probably a large percentage of individuals that have some sort of mental health treatment that they need and that they've avoided or haven't, I don't know, necessarily had the resources to address the underlying problem, but I don't have the statistic off the top of
I could address that, but
my
I don't
head.
want to.
No, go ahead, totally.
I've often said that I have a complete loathing for narcissists, especially since they make up 2/3 of why my clients are there. They're not 2/3 of my clients, but they make up 2/3 of the reasons why my clients are there. And narcissism makes up a big, I think it was like the word of 2021 or something. But anyways, I wanted to quote this. I was listening to this 3-hour podcast from a psychiatrist just a couple weeks ago, and this is the quote that he said: "Narcissists and sociopaths make up such an infrequent or small percentage of diagnoses, but it compromises the lion's share, more than 50% of bad things, evil things, destructive things we see in the world around us. I think narcissists are wildly destructive because they are driven completely, lodged completely in the lane of envy." So I think in total, to answer your question, they only make up 2% of the population, 3% of the population, but they cause more than 50% of the problems, and they are frequently the people that are breaking laws. To answer your question, that was geared towards Anthony. So.
Okay.
Yeah. And they don't seek treatment because they think nothing is wrong with them.
They're totally happy with themselves.
Yeah. And that's why they said a lot of my clients are coming to treatment because they wish these people would just change. Why are these people causing such havoc in my life? And then my clients feel powerless and they feel abandoned by these people, or they feel repeatedly hurt by these people, or there's the cycle of domestic violence in the honeymoon period, and then the build-up, the tension, and the explosion, and there's all the domestic violence that goes with the other horrible things that happen. So yeah. Sorry, back to you.
No. I wasn't sure what else to really say at this point. I didn't know if there's no other questions that I can. But
You mentioned an AFC, was it?
Yep.
And I was just curious as to what that was.
oh, an adult foster care. So for those clients for those individuals who need a little bit more help and don't have, I guess, housing, and need to have a little more supervision for different things, that's where they would go.
Okay.
Are you
This is
fine? Oh, I'm so sorry. Go ahead.
No, I just wanted all of you, maybe if you could address how well your programs prepared you and if there might be any insights for our current students, what you might recommend we should do to be out there, to be in field studies.
Of course. So specifically speaking to being an attorney, I felt like I was really well prepared leaving SVSU. I took a lot of writing and research classes because a lot of law school is geared towards writing and research. There's some oral advocacy that happens in law school, but it's not a huge percentage of it. So my recommendation for any students in the undergrad especially is to focus on your writing and reading and making sure that you can get through those comprehensions, because law school is very much a gamut of reading hundreds of pages a night, writing an outline, and being ready for any questions that you have from your professors. So that's my suggestion.
I think you might have just scared away many students.
And that is the hard part of all law school.
Any other questions for Anthony at the moment? I think we'll just kind of continue down our table and then we'll go to the folks online. So Jody, you might kind of give us your story?
My name's Jody Harwood. I graduated about 10 years ago. I did writing research for Dr. Lynch for a year plus, and that was very interesting. It seems boring, like to the outsider, but I kind of nerd out on writing stuff. Right now I have my primary job, my full-time job is at Child and Family Services of Saginaw. We see quite a bit of Saginaw Valley students. And then I also have a private practice that I've had since 2015, right when I graduated with my LPC. I'm a licensed professional counselor. I went to Central Michigan University for that. That was a great program. I chose that path because at the time, segueing into social work wasn't going to be easy for me. Unlike Chad that I've spoken to, like, sounds like that's going to work for him, but I'll let you elaborate on that. So anyways, I work in abundance of hours, which probably isn't the best thing to advocate for you guys to work in abundance of hours, but I can, and work has been plentiful for me, especially since the pandemic. Mental health stuff has just been doing this as far as the needs for mental health everywhere. I'm not doing as much telehealth as I was before, which I prefer not to do telehealth. Let's see what else. I'm trained in EMDR, eye movement desensitization reprocessing. It's a more of a body-based modality where you're integrating eye movements to help with both sides of the brain processing trauma while you're talking about the stressful thing, and it helps you reduce the intensity of the feeling. I'm also trained in EFT tapping. We have energy meridians in our body that when we tap on those while talking about the thing, it reduces the intensity. But as far as my time at Saginaw Valley, I would say the overall focus on writing across the curriculum was definitely helpful. By nature, I'm a very good writer, so I didn't struggle too much with that. The one doozy of a paper that I still look fondly upon would be the abnormal psych paper where they have you, and at that time it was Dr. Robinson, she's no longer here, but she had us write a paper on the movie Amadeus, and the character was Salieri, and we had to say, state your diagnosis for this character and write a complete biopsychosocial profile on this character and reasons why, and I ended up with like 23 pages, and it was helpful for me to really articulate all of that, and it really helped me learn how to write a solid biopsychosocial, so that now when I have to write something like that, if I have to, it's pretty well ingrained there. My top 3 classes that prepared me for what I do would be hands down behavior modification. That really helped me because I do a lot of behavior modification, helping my clients not only with their stuff, but helping them parent their kids. And then abnormal psych was by far and away one of the best classes that really helped me understand all of the different abnormal things that go wrong with mental status. And then neuropsychology was one of those classes that hits you like a semi-truck, and even though I left with a C+ in that class, I learned so much from it. So those are the top three that really prepared me for what I'm doing today. Any questions?
For somebody that's interested in going into counseling, what kind of things would you recommend outside of like classes that they be doing now?
Absolutely, I'd recommend getting your own therapy because to be a good therapist, you have to know what it's like to be on the other side of the couch. And if you don't experience a good fit with your therapist, that just means they're not a good fit. It's not anything you're doing wrong, so try and find another therapist.
To receive an LPC, what schooling did you have to go through? Master's, PhD, PSYC?
It's a master's degree. Right now, I think it's 60 credits. At the time when I went through, it was only 48. So you want to choose any school in Michigan, it would be 60 credits. CMU is a local one. I think there's probably a handful of schools in Michigan that do it.
Okay.
Yeah. Oakland University, where are you from?
I graduated in Harrison, but I've been around.
Okay, yeah, so if you want to pick something close to Harrison, like CMU would be close.
All right, thank you.
Yeah.
Quick question, because I don't know your clientele and who comes there. Do you deal much with intergenerational types of issues in families, particularly involving late life or older adults?
Yeah, actually, that's my theoretical orientation is
Okay.
transgenerational transfer of trauma. And when I was studying for my doctoral program, I actually had to drop out of that because I was going through a divorce at the time. I just didn't have the strength to go forward with that. That was going to be the theory for my dissertation. And it's interesting because there's some researchers in Washington that study transgenerational transfer of trauma in crows, and they actually were able to prove that it was being proved in crows. So, so I'm very a firm believer in stopping trauma with I love being able to help moms when they come and they're like, I went through X, Y, and Z trauma as a child and I don't want to repeat this with my kids. Like, oh, it just warms my heart. And then every once in a while, I'll get moms that maybe are finally leaving an abusive partner that's been abusive to them for 30 years, and they realize their kids have cut them off, and they have a lot of guilt about what has happened. And I'm working with one right now who's finally left the home with her partner, but she's not quite ready to break free from him, and it almost is like a Stockholm syndrome kind of thing. And she's still trying to navigate how to continue to have relationships with her adult children, but her adult children are so mad at her for what she allowed to happen to them as kids because she allowed this abuse to keep going on and on and on. So it's so tough because as a therapist, it's not our job to tell them what to do. And so I'm riding that fine line with her constantly of validating where she's at, helping her recognize that she said she wants to change. She recognizes that being with him does a thing to her, doesn't feel good energetically for her to be there with him constantly doing that. I call that cycle of abuse, domestic violence. So yeah, it's hard. Or when I have a 60 and 70-year-old couple that came to me and they don't understand why their 30-year-old daughter is just going to elope and doesn't want them there at the wedding. Those are interesting things because I'm right there in that Gen X, age 46, where I can see their perspective, but I can see the 30-year-old's perspective of they're just private people. They don't want a big ceremony, but 60-year-old mom is like, I feel excluded. I just want to be included. This child's the center of my life. So it's interesting trying to do a lot of cognitive reframing with them.
Absolutely. And how about care provision, where siblings don't come together for an elderly who has dementia or can't make decisions about because they just are not on the same page anymore?
Yeah.
Do you get much of that?
I don't. Chad and I were just talking about multiculturalism and diversity, and I do always keep in mind where's diversity and where's the culture and where's the religious aspect and how does it apply to that client. So I do make sure to include that and not to take my white hetero cis standpoint. I may have a very individualistic kind of standpoint, and so I make sure to include wherever they're coming from.
Of course.
Does that answer your question?
It does somewhat, yes. That was going to be my other question, was about diversity, so you answered that for sure.
Yeah.
So
I have to set that aside and make sure I'm changing, recalibrating where I'm coming from.
And it's hard to do that.
Yeah.
Yeah, no, I was asking because I teach an adulthood and aging class, and I try for students to really think about whatever skill sets they're learning in psychology, how they would apply it to a gerontological population as well, because they're going to have to deal with them as we come out of this whole tsunami of baby boom generation coming at us aging. So
I was fortunate in my doctoral program to get through a couple classes, and one of the classes was aging in the adult population and how that affects mental health. And I'm not sure if this is your same understanding, but at age 50 plus, we don't remember when we are early parents, we don't remember what was happening so much. We lose the details because when we're going through it as early parents, it's just so like, put out fire, put out fire, put out fire, put out fire. And so sometimes when we're 50 plus and our kids come to us and say, Mom, I was so mad that time when you were, when you didn't, I don't know, when you didn't give me a birthday cake on my birthday when I was 5, and we're like 55 years old going, I don't remember that. And these kids who are now adults are so mad at us that we don't remember that, like it didn't happen. But it's, that part of our memory was like 20 years ago, is we can't, so it's helpful to understand psychologically based, like our brains don't operate like that across the age span. Like for us, memories from 0 to 18 are this big. And if you're, 46 or whatever, for me, my memories are like this big right now, but I can't remember when my kids were like 2 or 3. There's just little photographs.
yeah,
It's helpful to understand that if you're working with people.
absolutely.
Any other questions for Jody?
Okay, I talked a lot, I'm sorry.
No, I just wanted to make sure that I wasn't even noticing the time too much. Well, let's make sure to move on to Chad then.
Yes, hi everybody, my name is Chad. I graduated from the psychology program in 2021, so just a couple of years ago, and just like Jody, I also did research with Dr. Lynch for a couple of years. I'm in the Master of Social Work program right now at SVSU. So before I get into that though, I think I was the first field placement class that just started up again since taking a little bit of a break, and my field placement was with an applied behavior analysis company. I was a registered behavior technician there, and I think that Sarah is a BCBA, so I'll let her cover some of those aspects. But as a registered behavior technician, I was responsible for implementing behavior plans for children with disabilities. I primarily worked with kiddos that had severe mental disabilities and severe problem behaviors, so I would work on increasing tolerating denial and finding some replacement behaviors, as well as finding the functions of behaviors as well. And it was a very incredible experience. It really helped me, it provided me with a very solid foundation of clinical skills. So that includes just some introduction to mental health stuff, such as, of course, autism, but then there was also some ADHD and anxiety aspects that I worked with as well. I had to write case notes as well, so that's a big part of any clinical job, so it was a very nice introduction there. And a little bit about insurance, and just in general, it was about working in a clinic, so it was a very great experience. Thankfully, it is an entry-level position. All you need to do is have a high school degree and you can get into this job. Not to say anything bad about it, because it really does take a lot of work. So even though you just need a high school degree, it doesn't mean anything about the position. It's a great job, but it's also difficult and it takes a lot. I decided to move into social work instead of staying within ABA because there were some more opportunities for me that I felt fit me a little bit better. I wanted to be a mental health therapist for as long as I could remember, so I went to the social work program versus the counseling program because my interests are changing almost on a weekly basis. So although I really wanted to do therapy, I wanted to get into social work because it fit me a little bit better, and social work is a little more broad, so I could work in policy as well. Mental health therapy didn't work out. My first year field placement, being psychology graduates, if you go in the Master of Social Work program, you'll have 2 different years. So my first year's field placement was at the Mental Health and Wellness Center on campus. And I was essentially a therapist without the credentials. I was providing the individual therapy and interventions to college students. And in the Master of Social Work program, I started doing research before I even began with one of the faculty members. and I had the privilege of traveling to Washington, D.C. to present at a national conference to present our research findings and our early research findings, I should say. And so with that experience, I decided to make that transition into macro social work, where I'm working more with policy right now, research and accreditation stuff with the Master of Social Work program office for my last field placement. So working with accreditation, I'm doing some research as well as working on statewide policy initiatives with different universities and some legislators as well. So I feel very confident about going into the social work program because I did make that change from therapy into the macro side of things and policy work, but it's really been a great experience.
Great. Questions for Chad, either about social work or about the internship program or anything?
You about the macro social work and how you're interested in working in policy and everything, and I was wondering if you could just talk a little more about like what that looks like and some of the type of things you do.
Sure, so macro social work is, micro social work is basically working with individuals and groups and families on a client basis. And macro social work is more on the policy, research, administration, and program management and evaluation side of things. So I want to go into policy and work on program evaluations and creating policies for agencies. And we're working on a couple of different, I shouldn't say bills yet, but initiatives throughout the state of Michigan. The social work licensure exam has quite a few issues right now to it, and there's a massive overhaul and there's an overhaul in attempt right now. We are trying to get more equality within our licensing process. So I've been working with the executive director of the National Association of Social Workers to try and work on some policy things related to changing what the licensure process looks like and making things more equitable within our profession. Debbie Stabenow, she's a Michigan senator and she's a social worker. I think within this most recent election cycle, there are more social workers within Michigan right now than ever before, working as representatives. So policy could mean agency policies, and it could also mean statewide policies, as well as just working for the government in the different departments.
So I have a question here about differentiation between approach from a social worker for therapy versus maybe a psychologist might take a perspective. So I don't know, maybe this is a dual question here for you two. But we do have a lot of students who are interested in therapy and counseling and the like, and oftentimes we'll have them consider a master's in social work as an avenue towards that. But do you know of any particular differences in the approach? It seems to me that social work is a little bit more systems oriented than maybe. Again, I think it depends on the particular approach taken by the psychologist, but or counselor. Do you have any insight into that, perhaps difference?
Yes, you're absolutely right. Our approach is definitely more systems oriented. We look at the different perspectives in terms of like the cultural perspectives and the systemic inequalities right now. So, and we look at how we can work with our clients on that level and see what exactly went wrong and why they're in the position where they're at right now, and see how we can kind of change that from a systemic perspective. So of course, we'll diagnose depression and anxiety and all of that stuff, but we try to look at it from a more background perspective. So what cases do you have? What are the socioeconomic differences that, or disparities that you've experienced that have maybe put you in this position? And we'll try to grab resources and provide those to you as well. I don't know if that's a similar experience, but in social work, we're very systemic heavy on approaching and treating clients.
I actually take more of a social work stance with my transgenerational transfer of trauma. I do a Bowen family systems model typically, which is more a social work model. But this analogy that I'm going to give you may sound slightly crass when I say it, but it's probably an easy analogy to understand. And sometimes social workers or counselors will use it to explain the difference. But if you have a kid that is coming down the river drowning, a counselor will go in and rescue the kid from the water and help the kid deal with like a solution about, oh my gosh, I'm sorry you're drowning, let's fix that. And then another kid will get thrown in the water and be drowning, and the counselor will go in and help the kid and say, I'm sorry you're drowning, let me help you, let's fix that. And the social workers will say, who keeps throwing these kids in the water? Let's fix this reason why kids keep getting thrown in the water. So that's the difference. Does that make sense?
Mm-hmm. Yes, thank you.
And I echo that. I think that's very, very accurate. Yeah.
Actually, I was going to ask the reverse question or the mirror question of what Dr. Weaver just asked. I teach lifespan development, Chad, you know that. And there are many, many, many instances where, and I go with the Brown-Fritz-Brunerian approach, so it's a systemic approach. You do have to look into culture. I'm also a cultural psychologist, so all those are part of what I discuss in class. But I know there are so many places where I sometimes will say, you should know these things and then start working with social policy, because that's where you want to make the change. You can keep trying to save every jellyfish, but you change one set of laws and you have a whole different outcome for masses of people. Would you say public policy would be the place for our students to guide them into any kind of grad school master's level? Or would social work macro systems work pretty similarly? Or if you even know what public policy masters would be?
Yeah, I truthfully don't know enough about the difference between social work policy and a master's in public policy. But I do think that there's a pretty fine blur between those two. Social work, we can work with developing new state policies, and there are multiple bills right now going through the legislature that came from social workers.
Okay.
So social workers can help draft those policies, and they also are interacting with clients on a regular basis that might give them a push towards proposing new bills and policies to be put in place, so they get that unique perspective too.
Okay.
But for the master's in public policy, I guess I'm not too sure about the difference between that and social work
That's okay.
policy.
They work with public policy too, so that's where I used to think people can go, but I think what you're doing might be something many of our students would be interested in getting into.
And policy does sound super dry when we're talking about it. It's not necessarily an exciting topic, but I'm very interested in it because I found it somewhat difficult to work with clients one-on-one on an individual basis, but I could only do so much. It was very gratifying, but I wanted to make that focus both because I had that experience in traveling to Washington, but I wanted to change my perspective and focus on policy so I can try and capture everybody versus focusing individually. And I know that a lot of people have different perspectives on that. There's no really right way to do it, but I think that it's more fitting for me.
I think it comes down to knowing yourself and knowing how you work best. And for me, my amygdala just fires up when I'm one-on-one helping somebody. It's like 4th of July for me. And having to sit behind a computer researching like policy would just be so dry, and my ADHD would just be like that, and I wouldn't be working well. So yeah, so it's just whatever kind of drives you.
Yes.
So whereas one-on-one would probably burn him out with like helping people with their problems, it makes me thrive. So.
Sure.
It's also interesting how a lot of these issues are spanning across the 3 speakers we've had so far. Like, again, what causes people to be in the criminal justice system and in your office, so. However, we should make sure we move to our online guests as well. Here, I think we kind of see Paige next, so if I could call on you, Paige.
Yeah, hi, I'm Paige Recker. My title is Access to Care Manager for the Michigan Center for Rural Health. So I actually was a human sciences major when I was at SVSU. So I did not have a psychology minor or did graduate with a psychology degree, but always have been passionate about behavioral health. I graduated in 2018 from SVSU and then went straight on to get my Master's of Health Administration at University of Michigan in Ann Arbor. During that last 6 weeks of my graduate program was COVID, so really got hit hard by that and had a career or a job lined up after that. But obviously where I was going at lost a lot of money due to the pandemic, so kind of was having a hard time finding a job, but was with the state of Michigan for about 7 months as a COVID-19 case investigator. And then for about a year after most of 2021, I helped actually at my in-laws business. Their family business was really exploding after COVID or during COVID, which was great, but they needed a lot of help. So kind of transitioned there for a year and then decided I wanted to go back into healthcare and was with the state again through their primary care office. So there I was dealing more with loan repayment program for site applications for the National Health Service Corps. So that's the federal loan repayment program, and then also was helping with a behavioral health grant that they were awarded, but then was only there about 6 or 7 months and then decided to go to the Michigan Center for Rural Health. So been here since end of May of 2022. I've really loved working here. And my title to Access to Care Manager really involves 3 things: workforce, behavioral health, and telehealth. So behavioral health is really the main thing talking about today. You know, I'm not coming from a psychology or social work background, but really been passionate to help get access to treatment for our rural communities. So there's obviously then too with the workforce side a shortage of social workers, clinical psychologists, psychiatry, especially everything north of Midland County, so starting around Clare County and north to the UP and the northern lower peninsula. So really trying to work with our rural organizations, our rural hospitals, our rural clinics, community mental health agencies to kind of help with the workforce side. And then also too at the center, part of our strategic plan is trying to, how do we get access to treatment for those rural community members as well. So we've been kind of, strategizing. There's about 7 of us that are on our behavioral health group team. So really trying to find different innovative ways to integrate behavioral health within their community. So that's kind of some things that I've been working on, and really just the workforce side. I also connect with universities, like kind of today with psychology and social work, to get them, hopefully interested in one day working in rural Michigan or in a rural area. And then also too, if you go on for your graduate or master's or doctoral level, that there are loan repayment programs out there able to. So I just kind of make them aware of that because they know college is not getting any cheaper. And especially if you're debating to continue on your degree as well, there are options through the federal and state government for clinical psychologists as well.
Before I forget, I very recently heard about a kind of a loan repayment or way to finance your way through school psych programs as well that the state is offering, because there's a big need for folks to go to rural areas, folks to go into schools and so forth. You all, I don't think things are going to change in the next couple of years. You all have a very good job outlook. We need you. But questions for Paige about healthcare or some of the things she does.
I have a question to follow up on what you were just saying about having, that there's funding available. How would folks go about like finding that or researching that more, the funding that's available?
Yeah, so the federal one is called the National Health Service Corps, or NHSC. If you just type that into Google, it will pop up right away, and actually it's opening soon. They haven't sent out the exact date, but I'm assuming probably early March. So that's for loan repayment programs. So if you have, again, master's or doctoral level debt, that degree debt, that you're eligible for. And then also the Michigan State Loan Repayment Program, if you type that into Google as well, it will pop up, also eligible for that as well. So both, just want to clarify too, you are required to do 2 years of service in a rural or underserved area. And in return, get for the 2 years, each, no matter the federal or state loan repayment program, $50,000 in loan repayment. And you can continue on for more than the 2 years of service. There's a limit for the state one is 10 years that you can be in their program. And then also the NHSC, I don't know if they have a time one, but at a certain point for that, the funding does go down. So you wouldn't be getting the $50,000 or $25,000 a year every year, if you continue down past those 2 years. But both are, yes, very well funded. And, we're expected, I would say, at least the next 5 years to be very well funded due to the pandemic and the need for behavioral health workers as well, too. And I can also pass along, or I don't know if Dr. Lynch too, with my email if anyone needs help or assistance more too with, or just general questions about the loan repayment programs.
Thank you.
So I have a question. This is Dr. Weaver. I'm wondering if there is any particular skill set that seems relevant for helping in rural communities that that you've noticed. I know that you said just access to care in general is a deficit, but if there's any particular things that you're looking for behavioral health or mental health.
Yeah, I think definitely a few things. I think, definitely cultural competency is a big component. I think a lot of people do think that, primarily rural communities are, white or, pretty basic on the surface level, I guess, there too. But really there is a lot of different cultural components, especially once you move to those northern regions and you see a lot of tribal communities, as well as a lot of migrant workers as well that comes into the communities seasonally, but two, just being culturally competent as well. And many do, you deal with an older generation, but also too, there is that mix of younger generation as well. So I think just being aware and mindful of that too as well. And then I think just not having a stigma around rural communities. Again, I think many people think rural communities don't accept outsiders or that. And that's not the case. And I think, even if you came from an urban, grew up in an urban city or place or county, I think rural county, it's going to be different, but definitely be, open to it. And I think many people in these rural communities are open to people who aren't from around the area as well. So just not having that stigma that might be out there surrounding rural communities.
Thank you. She can't see you. You did that.
Oh, yeah, you go ahead.
So, Paige, would you say that exposure, we get a lot of students who are from rural communities. Would they be working one-on-one with community members or dealing just with systemic other individuals who are sort of delivering services? Would they be delivering services directly?
I would say majority that we're looking at is definitely directly services to patients. I guess I haven't seen too many of the systemic in our rural communities. Doesn't mean it doesn't happen, but I would say definitely more of those one-on-one services.
Well, thank you. I think we should move ahead for Sarah, and then we can continue to ask some questions.
Hi. I will say I'm not much of a public speaker, so I feel like I have a little bit to live up to following everybody else on the panel, but I will definitely try my best. My name is Sarah. I am a board-certified behavior analyst at Encompass Therapy Center, which is located right down the road in Bay City. So what I do here, what we do at Encompass is applied behavior analysis, which is a field of work that is based on research-based intervention and also based on the principles of positive and negative reinforcement. Within ABA, we look to increase the quality of lives of children, teenagers, and adults with autism. At least that's what we do at Encompass here. We really focus on some of those deficits in regard to communication, in regard to social deficits, maybe some behaviors that are very restrictive or repetitive. In regard to my time at SVSU, I graduated in 2018. I knew I wanted to go into psychology almost as soon as I got there, 4 or 5 years earlier, but I wasn't too sure where I wanted to go. There was a lot of different areas within the psych program that really interest me, but a year or two before I graduated, I took a class called the Psychology of Learning, and it really, really clicked with me. And, it was based on those principles of reinforcement and punishment, and I found out that there was a field out there that incorporated a lot of these, and I definitely wanted to give it a shot. And during my graduation in 2018 within the psych program, I know it was really booming at that time, and a lot of people were also interested in it. So, I I found a ABA center in Bay City that I really enjoyed. It was in Compass, and I started off as a behavioral technician. And eventually, I took a big liking to the field. I was still incredibly interested in it, and it was very rewarding for me. So I decided to go get my master's degree from Ball State University in 2021. And after that, I went to go take the board exam, and I passed it, and then I became a BCBA. I understand now. I think that SBSU has a newer program for this, but at the time when I first went to school, it was not a thing yet. But I definitely would have been interested in doing that through SBSU for sure.
What kind of things do you do on a daily basis, Sarah? Or is it just too much to summarize?
Oh no, there's so much. There's so much that we do. So we work one-on-one with children with autism, like I said. As a behavior analyst, what I do is I create the programming that each kiddo needs when they come here, which will help with the deficits that I discussed earlier. And then a therapist will do one-on-one programming with them for the time that they are here. Also with my job, I meet with parents 1 to 2 times a month for each kiddo. I meet with the families 1 to 2 times a month. And we discuss generalization of the skills that they are learning to the home environment or to the school environment or any other important environments. We discuss maybe any difficult behaviors or newer things that they're noticing that we can try to work on here as well. So that's pretty much a typical day here as a PCBA.
It is a booming field, and if you don't know already. And so very much in need. And the program, the grad program that's at SBSU is through the education department. So I can't speak to it very directly. But I could point you to the folks in education. Any questions for Sarah?
Sir, I was wondering if you could give us a concrete example of kind of reinforcement that would be used with a child. Obviously, no specific case, but when I teach about learning in my general psychology class, I mostly talk about rats and operant conditioning chambers. Could you talk about the real world and what are the real world reinforcements used with the children?
Yes, absolutely. So to reinforce a behavior means that we want the behavior to continue to happen. We want it to increase in the frequency in which it happens. So what we do at Encompass is we find what the child is motivated for, whether it be, the gym, the nut room, it could be an activity like tickles, or it could be reading a book. There's so many other reinforcers here as well. But when we're teaching a new skill, I'm trying to think of a functional living skill so toilet training, for example, that is something that some of our children don't, they don't learn it as quickly as other children may. So we have to, kind of tweak our system here and figure out what's going to work for them. So in that case, we may find something that they really like. Their parents will bring in like an object from home. This recently happened. It was like a huge toy castle. And we start shaping the behavior. Okay, let's sit on the toilet every 15 minutes and try to produce a urination void. And if we get that urination void, the child will be able to use the castle for a certain amount of time, for a very large allotted amount of time, because we want that behavior to continue to happen. Let's say the next day the castle is no longer reinforcing and they really want us to, grab a disco ball, do a dance party in the bathroom. We totally will do that because we just want to use what they're naturally motivated for in order to make the behavior continue to happen.
Okay, great. That makes it clear.
Any other questions for now?
I have maybe, sorry, did somebody else have one? I didn't look around, I just jumped right in. Can you speak to the that process again of going through behavioral technician to board certified? Now you said that you got a master's, and I assume that's a requirement to be a BCBA, is that correct?
Yep, it is a requirement to become a BCBA. So you have to get a certain amount of field work hours that are direct with the client. Right now you have to get 2,000 directly with the client. and 2,000 indirectly with the client. So that's doing more of like the, taking data, making graphs, stuff like that, creating programs. And once you get those requirements in, you also have to have a master's degree. The master's degree that I specifically got from Ball State University was a degree in psychology with emphasis in applied behavior analysis with autism. So it was very specific. And then you send all of this information, your transcripts, to the board. And if you are approved, use it to take the board exam. And that's how you become a BCBA.
And did you find the board exam to be, I know that we have somebody else in here who took a bar exam. I know that this is kind of probably be apples and oranges, but can you speak to like the preparation time that went in for that?
Oh
board
yeah,
exam?
absolutely. Yeah, I took 6 months to prepare for it. Of course, a lot of what you learn, you have to apply to what you do every day, and some of it just gets very intricate and intense, and it may not be things that you see every day. So taking like about 6 months for me helped me to understand all of the topics on a more in-depth level in order to take the exam. And it was a challenging exam, so very glad I was well prepared for it.
Thank you.
I do want to have a little bit more time for questions and answers, especially if you wrote down a question. But if you don't mind, we did, one of our other alums really wanted to be here, but she had to work and she's new at her job, so she didn't feel like she could take time off. But her name's Alexandria Dahlkirk. She just graduated, I believe, last May. So really recent grad, but she wanted to speak a little bit to the internship program. But she was also part of that internship class that Chad talked about, although just last year, and he was part of the first year. So I'm going to read something she wrote and sent to me that she would have said if she could be here. So if you just give me a minute here. It says, from January to June, this was just last year, I had the chance to intern at Holy Cross Services in Saginaw. Holy Cross focuses on helping individuals who need all types of different services related to rehabilitation. Most of the individuals are juvenile youth who receive inpatient treatment. This treatment ranges from behavioral therapy to continuing their education within the facility. For 6 months I was there and worked with the girls unit and was able to see how psychology and criminal justice can be blended. When I first started, it was something completely new. I always knew that I wanted to go into forensic psychology, and being able to work with juvenile youth solidified that. Every day was something different, and it allowed me to be able to see the ins and outs of how things worked within the two fields. While working there, I gained new skills that I'll be able to apply in the future and in my current job. The first skill that I developed was de-escalating techniques for tricky situations. These techniques not only ensured my safety, but allowed the youth to feel safe and respected. Although some situations can be more on the aggressive side, I learned that not only to verbally express empathy, but to show non-judgmental and non-verbals as well. When dealing with a situation that needs to be de-escalated, it's important to make sure that you are not adding to the stress of the situation. Allowing individuals to let out feelings in a safe way makes it so they realize that emotions need to be felt, but there is an appropriate way to do so. Throwing a chair is not the best way to get out, but verbally expressing so one can do so much more. Another skill I learned, although simple, is patience. While working with juveniles in specifics, it is important to take a step back and not try to take over. Even though they are teenagers, there are some things in the past that can cause them to react the way they do. Instead of just trying to jump to conclusions right away or shut the situation down, I learned to allow them to take their time, think and reflect, and to see if there's a solution that they can produce themselves. Not allowing them to process or say exactly what they want to say can create major impact with the trust in the relationship. Lastly, an important skill I learned was supervising group dynamics. This allowed me to see how group sessions are facilitated and what activities work best. Usually in sessions, people can believe that the therapist does all the talking. But when seeing it in person, it's important to make sure that the group leads and you are there for support. This was something that I always struggled with, since typically you feel as though you are meant to lead. But I quickly learned that the best results come from allowing the youth to lead the discussions. It allowed for more impactful sessions. The only challenge I had while being there was building trust with the youth. Obviously, as teenagers, they are going to see how far they can bend the rules with new individuals. But I quickly learned that just treating them like they are teenagers was the best way to allow them to trust me. I went into the situation knowing that these teenagers are in the system, criminal justice system, but at the end of the day, they are teenagers who are stuck in tough situations. The majority of them had tough upbringings and never had the ability to be a kid. Although it's important to help give them the resources to guide themselves in a better direction, sometimes a normal chat and card game will give you the opportunity to build that relationship and allow them to trust you that you are there for them. So that's from Alexandria, and again, her internship's last year. I do want to get to questions and answers, but I feel like I'm going to forget a few resources if I don't say it now. So first, one resource is snacks. So get those before you leave, okay? Or even get up now and get them. Feel free. But also back there is just a plain old white sheet, but it gives you a QR code to get to a website that our own Dr. Pashik has developed to help folks navigate some of the different paths they could take, especially if they want to go into one of the helping professions. So social work versus a master's degree versus kind of a PhD degree in psych versus some other related fields. So that's on the white sheet there. And then we also have a little flyer about our internship program. Again, Chad talked about that. That's what Alexandria in her statement was talking about. You can do that your junior or senior year here. Take 15 people a year during the regular semester, and we might be able to do some summer internships too. You just need to talk to me, and again, the flyer has that information. Oh, and also, we have a few books from the library. Did Dr. Dada take those?
She might have taken them with her when she gathered her things.
Maybe I'll put that on our Canvas site. I should have written those down. One is about being a psych major, which we also have in our psych office. And then she had another resource too. She
I didn't see that.
Okay, okay, so sorry about that. Let's see if I got all the other announcements I wanted to do. Yeah, I think that's it. So,
Can I make
yes.
one plug
Yes,
on
please
behalf
do.
of Nick's office? So I don't know if you would like to make this plug yourself, but for SVSU Connect, in terms of connecting with alumni who may be able to.
Yes,
Sure.
please.
No. Thank you. So if you are an alum already, or even as students, we have a way to connect online. If you go to the SVSU alumni website, so just svsu.edu/alumni, you'll see a button for SVSU Connect. It's our online, I treat it like an online directory. It's a way for alumni and students to connect with each other and see some of the resources that we can share out there for folks. It's a great resource even as students to get involved and to sign in because it allows you to kind of see some of the folks that are out there working and doing things in your major and then connect with them as well. So don't be hesitant to take part. We appreciate it.
So just as an aside here, I didn't use it for professional development per se, but doing our departmental assessment that we have to do every few years, I reached out to folks on there, and people who have no idea who I am were very friendly and shared lots of information. And I'm not an SVSU grad, so I'm sure they would be even more forthcoming for those who that read Pride. So
what's really nice about it, and the reason I think people are very accommodating on there is you have to go through a verification process through my office. So it isn't just like Facebook or LinkedIn where all of a sudden you sign up, you got an account, and then you can start going in. So you're not going to get a lot of solicitation through it. It's only a way for folks who our office can vet and make sure that they either are an alumni or a student can get in there to make those connections. So very, very helpful.
Did anybody have a question on their note card that they wanted me to ask? Or that you wanted to ask directly? I had a few questions, but I want to give you guys the chance first.
I think it's your time.
Okay. question, and some of you already addressed it, so it's okay if you already did. But so many of our students know they want to do something with psych, but they just haven't gotten that spark yet. That like, where do I go with this? So if you didn't address it already, when did you figure out how did you figure out like what you were going to do with your degree? Either psych or your criminal justice or your public health?
Well, I came to SBSU with the intentions of becoming an attorney. I wasn't sure specifically what I was going to do with that just yet. I knew something with criminal justice most likely, and just let that lead me where it did throughout my time at SBSU and law school afterwards. So kind of came in a little ready.
Okay, that's great. That is nice when you know.
I'm not a traditional student. This was actually my second bachelor's degree, and my LPC was my second master's degree, so I was with accounting for 8 years. And then when I sat down with Dr. Kassar, I said, okay, so what do I need to do to get this bachelor's degree? And she showed me like specifically what I just needed to do with psych classes and then one biology class. So I knew I was coming here to be a therapist, and so it's like I knew exactly what I was going to be doing. I wanted to become a therapist, and so I needed to get these psych classes out of the way and then go do the grad school. So I knew already.
But what prompted the switch from accountant to therapist?
So going back to what we talked about, like I was, you know, how you said your systems and macro, and I didn't want to, I don't know if that's sitting in front of computers. Doing a lot of computer work or no?
You can be.
Yeah,
Yes.
I was doing a lot of computer work and I was bored out of my mind.
Okay.
I have ADHD, and so once I learned all that stuff about myself, I was like, I need to work with people. I need to listen to their emotions and problems and solve them, like, and that just lights my brain up. And so once I figured that out, I was like, oh, I can be a therapist, help people. So yeah.
I had always known that since around high school, I thought that I wanted to be a therapist for, a very long time. But my now fiance was telling me during COVID about social work, and she was saying it's so much more than therapy. It's about the systems and all of that good stuff. So I started looking into social work more, and I made the switch. I felt it was a little bit more fitting for me, and it also gave me that flexibility. But for what it's worth, the majority, and quite frankly, I think it has been all of the professionals that I've worked with in terms of mental health, have said that people who have a psychology major or minor and go into social work always have the best foundation because they have the human behavior and motivation and all of that good stuff. So you're in a good spot if you're in the psychology department and you want to make a switch into social work or quite frankly any profession, because you're getting a really good foundation of knowledge right now.
Anyone else?
I do agree with what Chad said about just the foundation being laid, that we got during our time in the field at SBSU for psychology. But I really enjoyed how a variety of classes were offered, so we could kind of see, what did spark that interest the most. As Jody said, just like that feeling of helping somebody, like, lights you up like fireworks inside, and I 100% agree with that. So I was like, maybe clinical, psychology, like what would work best for me? So just having the variety of classes did help me figure out where I wanted to be. So.
The other question that I get all the time from students is, you've already kind of addressed it, but PhD or master's, especially if they want to go into therapy. So I guess this is a question, sorry, for kind of specific to Jody. But did you find any problems with getting I shouldn't say just a master's, but getting a master's versus a PhD?
I tried to apply to the clinical psych programs, but they are extremely competitive, and each program only allows anywhere from 5 to 9 people in, and you have to take, I think, the GRE. With my strong writing skills, I would score really high on the writing portion. I got like 96%, but like the math and science, scores were not good enough, not high enough to make me a strong enough candidate. I think I had interviews for 2 of the schools, but it's just nowhere near able to get into those schools. So it's just extremely difficult to get into those programs. The end result, though, if you're able to get into any of them, the end result would be that you get paid more as a psychologist. Probably like an extra maybe $15 per session, but as a private practice person, but you're doing a lot of research work, maybe an extra couple of years. You know, so it's just weighing out the pros and the cons. Is that time worth it? I did end up doing the doctoral program. I was telling Dr. Dutta that I was doing a doctoral program in counseling education so that I could be somebody that educated other counselors on how to be a counselor, and then teach in a college setting because I like educating people. As you can see, I like talking to you guys. But that I had to end up stopping that. I was going through divorce at the time. So, but yeah, I don't know if it answered your question.
No,
It's just
you did.
a difference in pay rates.
Okay, but you're doing similar stuff. Okay.
Can I ask one general question? Maybe this is self-interest from the SVSU psychology department here, but is there anything that you wish that we would have done or could have offered that may have better prepared you for what you're doing now?
Understanding ourselves and how we work might be helpful. Like I know Delta College does a free personality assessment and free career test to people that live in the 3 counties. But maybe some kind of testing like that so that we can understand. Like I went to therapy a lot to understand how I work individually and one-on-one versus in front of a computer. But maybe some of these students don't understand that and they go off to work. Chad, for instance, wanted to start with therapy and then realized he didn't like that. But maybe somebody graduates from college and doesn't even know that, and they go off into a career and realize this is not working for me. But that would be helpful for a college experience to know that, know thyself a little bit more informed before you graduate.
Thank you.
That could have saved the whole this being my second career thing,
Okay.
if I'd gone through that my first career.
I'll run that by the IO psychologist later before he skedaddles. Some assessment stuff.
There's several assessments out there too that would help accomplish that.
I'm talking to the students here. I know Career Services has something of a career assessment. Did you guys take that? No, okay. You have no idea what I'm talking about. You've heard of it? Okay.
A lot of college kids have anxiety, though they wouldn't even seek that out on their own.
Okay, I was curious because I heard Career Services really talk it up, but maybe it's not really well known.
So you think a little bit more direct
More
integration with
or more extra credit driven or something like, hey, today we're going to talk about Myers-Briggs. Today we're going to talk about it's the one with the 9 different personalities, and then today we're going to talk about DISC profiles. Today we're going to talk about, you know what I mean?
Mm-hmm.
Build that into an assessments class. I don't know if you guys offer assessments classes.
Well, I think variations of it, but not just strictly assessment.
Mm-hmm.
Maybe?
Any
Maybe it's
for
on the books
folks
already.
online? I've been totally ignoring the folks online.
I haven't seen anything come up in the chat.
Okay. And everybody's always shy online. Okay.
I guess back to that, we're teaching our students how to understand everyone else, but we need to understand how to understand ourselves.
I think as psychologists we would do that, but not necessarily, right?
I think the majority of the healthcare professions, as long as you're working with people, to some extent, it requires reflection. So I think that would be really important. But so integrating that somehow into the curriculum, I think would be really important. But I think it could be different for other grad schools too. But at least for the social work program, we routinely have reflective practices. So I think it might be built into any grad school, but it could be helpful to filter out some professions from another one. I do think that the psychology department had a lot to offer though in terms of research and different opportunities. you're able to get leadership experience and volunteer experience, research, and all of which looks really good on a resume for jobs and for grad school.
Thank you.
Okay, well, we can definitely hang around if people want to get some snacks before you leave and ask any one-on-one questions to our panelists. But thanks so much for coming out on a not so great weather afternoon. I appreciate people being here in person and those folks who have been joining us online too. So thanks so much. Let's thank our panelists though.
Alrighty. Well, Sarah and Paige, I want to say thanks again for joining us, and I'm going to go ahead and end the Teams meeting, but if you have anything else you're ready to go, target for sharing resources, Paige, I know that you had mentioned a few websites and things. If there's anything you want to contribute on behalf sorry, it's getting a little loud. If you're willing to share that, we'd be happy to pass it along.
Last time I was sorry that.
Sounds good, yeah.
Well, thank you so much. Yeah, right.
Thank you.
Thanks for being here.
In the future is how I haven't actually tapped into whether